Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. You were so okay. Now, I want to let you know before I start talking the topic. Today's topic is actually calling the topic is what is migraine headaches? Okay. Now, before I really start, I want to tell you that tomorrow night from 8 New Zealand time, 8 to 10 o'clock, then I'm going to have an event, which is webinar. Then I actually put it in here that in this live video. If you're on my Szenan-Balance Method Spirit G acupuncture page, then you will see the event on that. So you can go and have a look on the event and sign you up with the event. It's free. We're gonna talk about acupuncture in Chinese herbs to treat IBS, irritable bowel symptoms. Okay, and tonight I'm going to do it in Chinese platform for Chinese practitioner. Right. If you're a practitioner, and please go ahead and sign up, and we're going to discuss IBS tomorrow night. Now, today's topic is what is migraine headaches. Right. If you're up here, please give me a thumbs up. Say hello to me. Yeah, that's important, because if you say hello to me and I know who you are, otherwise I can't see who you are. Actually, I don't have any idea. Hi, Veronica. I can see you now. Yep. We're gonna do on two platform, a few more platform on Facebook with my live every morning. I got managed another computer in front of me. So we include my clinic page, Center of Balance, as well as my acupuncture page. So all the acupuncturists can join us, and we can discuss about migraine every morning. So onward from today, we're going to discuss what's migraine headache symptoms, all right, and what is the sign of it, and we're going to discuss the silent migraine as well. Then we're going to discuss what caused migraine, then what treatment in Western medicines for migraine. Then we're going to talk about what treatments in Chinese medicine and acupuncture for migraine. Then we're going to talk about what can you do at home, what can you change in your lifestyle then to get your migraine better. So then, and what is the outcome of migraine, and can we cure migraine? Can we fix migraine? Okay, all this topic, every morning in New Zealand time. Then I'm gonna talk just one topic, as I can't talk everything in it may overwhelming for you. So we keep it in half an hour live video, okay, to feed you some information. Some information. And if you're patient, and it's important for you to understand all this thing. If you're a practitioner, yes, it's important for you to understand all this thing as well. Then in the end, I'll tell you what is a quicker way to do it, give you some information. Right now, you can choose Western medicine or Chinese medicine. It's not up to me to tell you, hey, you should do this, you should do this. I'm here to give you information and let you know what would be the outcome of it. Okay, I'm not saying that acupuncture or Chinese medicine can cure migraine or Western medicine can cure it. I just give you information and you make your own decision. As a practitioner, you need to know both sides, and apart from that, you need to know what can they do, because there are a lot of things that patient can do at home, you see. Yeah. So let's start. What is migraine? Right. So migraine headache is a neurological conditions. We all know this. Okay. So, and what causes it? You know, it varies. You know, migraine, we call it migraine and not headaches. That's because there is a big difference. To be honest, I never had any idea of migraine. By saying that is, I don't experience migraine. You know, I hardly ever experience headaches. The one time that I experienced headache that's very bad, it was I was on a airplane, and when the flight go up, and I started to get headache, and it was so badly like I want to explode my head, and it took about 5 minutes, gradually get worse, and then get better, and no drugs. I just do the acupressure point. Luckily, I'm an acupuncturist, so I do the acupressure point, and eventually that headaches went away. And then I feel, oh, this is what headache is, you know. So I'm pretty lucky. I don't get headache. When I get a cold or whatever, coughing, I don't get headache. But people do. Some people just get headache straight away. Even though I have neck problem, you know, my neck, we all have the curve, but my neck is pretty straight. You know, I took a X-ray when I was in uni because I got pencil needle down my hands and all the symptoms about neck problem. And I got treated. I changed my pillow and do a lot of things. And I know my neck is still quite straight, not losing the curve. You know, then a lot of people have neck problem. They will get migraine too, but not in my case. Not in my case. I don't get headache. Not get migraine. Okay, my wife did get migraine. Right, so I see a lot of people get migraine. All right. So how does it develop migraine? So the reason, the cause of migraine is unknown. But by saying that, there's still that migraine. If you have family who suffer from migraine, then yes, more likely you have migraine. Again, when it comes to family issue, it's unknown that we know this is because the diet, the lifestyle, and the emotional, how you actually react to it when things happen, and they all count. Because if you're a very stressed person, like, you know, you're scared of everything, you worry of everything, and when things happen, you just react that way, you learn it from your parents. So when they have migraine, yes, you're gonna have migraine too, you know, more likely to have migraine. So this is what I think put into, right? But there is different. Like in my wife family, none of them get migraine, but only my wife, and that may be other issues, you know. So it won't be just, you know, you can't put migraine that is a family issue. You know, it's some family in my patient too. The parent, none of them family get migraine, but only them get migraine. And then we really need to find out what's going on. It can relate to the tooth, you know, and it can be related to the stress, you know, it can be related to your neck problem, you know, also. And according to Chinese medicine, it can relate to organ imbalance, right? So what is the difference between migraine and headaches? Okay, migraine, headaches, you get it, it will subside, and it works with a lot of drug, a lot of painkiller. When you take it, it actually can subside. This is how my patients, I have migraine, I have headaches, and ask them, what is the difference between migraine and headaches? And all my patients tell me that migraine, when it happens, you know, you can sense it, or it suddenly happened, and it's quite strong. It's much stronger than headache, and it doesn't get better with any painkiller. That's how they work out. Okay, if they take painkiller and the headache will subside, and they know this is headache, or some headache not actually causing the blurry eyes, you know, the vision. they are not sensitive to light. A lot of migraine sensitive to light. It's too bright for them. They have to be in a dark room, and they're sensitive to noise. That is migraine, right? And headache can transform to migraine. And no, I haven't heard any people say that migraine is transferred to headache. No. So the migraine, it can last longer, and they can't focus. And headache is, they can still focus and do things, unless it's very bad. But when they have a risk, it went away quickly. And that's how they judge. That's how my patient told me that this is migraine, this is headache. The difference between them, I don't know about you. If you have any other experience, I would like to share with me how you feel with your migraine and headache. How could you tell the difference? Because again, personally, I don't get migraine and headaches very seldom, right? So only experience once that on an airplane, and I never get a headache. So it's quite lucky of me. But what about you? If you have migraine and headaches, or if you're a practitioner, you, when you treat your patient, how could you tell this is migraine, this is headache, right? And I have to tell you, how do you diagnose migraine, right? We're gonna talk about it deeply again, but in the overall about migraine, what's migraine is, the symptoms, or it can pain in here. It can be just one side. People thought, migraine in Chinese medicine we call 偏头痛, which is headache on one side. But it won't be just on one side, but mostly it will be on one side. A lot of people is whole head painful, or on the top, or just on the front, or in the back, and that can be migraine too. Right? That can be migraine too. So we're not sure how it developed, but pretty sure that that is when you have stress, a lot of stress, anxiety, a lot of work. You have a lot of stress at work. You have to, you can't keep up with your task, and those cause migraine. Okay, and period. Some women get period, they get migraine. Okay, now I want to tell you who will develop a suffer from migraine most, and the adult, mostly the adult. Okay, but when did they start? And some started when they're kids. Okay, it can start experience in the, most of my patients, they experience when they were little. They, when they were kids, primary school, and they start to get migraine, and then on and off every year until they become adults, they still get migraine. Okay, and I do have some patients, when they were kids they get migraine, but when they grow up, disappear, and never happen anymore. And I asked them, how do you treat it? I don't know. They have no idea how they treat it. They have no idea how they get better. So, and here is a missing page for me. If you know the answer, or if you, you don't have to be a practitioner to know the answer. You just need to, I want you to share your experience. If you know it, put a comment in there and share with me about your family, your friends, and your patient, and how they tell you, because migraine is difficult conditions, and there's a lot of things that's missing that we don't know about. We are still learning about migraine. I'm here to just share with you that what I know about migraine. All right. Now, so it developed when you're little. Most people fell in the early age. Then when they're adult, they still feel it. Okay, and who suffered more? And in the study, in my clinic too. Okay, like woman, female are winning in here because more females suffer from migraine. than male, you know. We're not quite sure why, but it may because of the hormone, because related to the period. And I do have patients that only get migraine when they have the period or when they close to the period, but 1 week or 2 weeks closing line up to the bleeding period, right? So that is pretty scary, because every month you know, and you worry about it as well. You know your period's coming, then you're gonna have your migraine, and when you have a migraine, you can't work. Okay, now migraine is about the symptom. You know, we go quickly about the symptoms. It can be here, 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 and but most of it is just once on one side, and they can as well as they get blurry version and light sensitive, you know, or some people lost the vision, right? Or they can get tingling and numbness in hands and tongue, you know, and all the face, and they feel one of the things is one of the things that migraine and headaches are very different is headaches you can still function, migraine they feel weak, so weak that they can't function and they have to stop things, have a rest, go to bed, and silent, and everything have to be dark and just themselves. They can't hear anything, any noise. Denise, migraine can happen when heart events suddenly come in life, like emotional shock. Yeah, I agree with that. Yeah, Denise, thank you. Yeah, you are right. Yeah, you're right. Okay, then migraine can also have confusion. You know, oh, I don't know what to do. You know, and miss out a lot of things. It can even have difficulty speaking. You know, conjunction with that, and dizziness, diarrhea, vomiting, feeling nausea, and abdominal pain. When you're Chinese medicine, the acupuncture, when it comes to diarrhea, vomiting, abdominal pain, you know those patients are this condition. You have to treat what? You have to treat the stomach and spleen, the digestion. You know, and those people, not just they having stomach problem while in migraine, that actually in the lifetime, and in general, they have stomach problem. Then you just need to treat the stomach problem. You know, keep improving the digestion issues, and then the migraine will subside. And we see a lot people with IBS, which we're gonna talk the IVF tomorrow night. You know, the case, and they as well as having suffering for migraine too. You know, a lot of people have this. You know, and I want to tell you this now. We just talked about the symptoms: migraine with blurry eyes, light sensitive, vision loss, you know, tingling, numbness, weakness, confusion, difficulty to speak, vomiting, diarrhea, and abdominal pain. All these symptoms plus migraine, right? That we call, oh, it's easy. This is migraine. It's easy to diagnose with migraine, right? But you probably didn't know that. One of the called silent migraine. With silent, if you have headache with, you know, it's easier to put it down to diagnose this is migraine. But some people that actually don't get headaches at all. There's no pain or tenderness on the head. What they just get is dizziness or just blurry eyes. They lost the vision and they vomit. And that's the harder ones to diagnose, you know. And one of the way to diagnose migraine is you have to roll out everything. Like you have to get a CT scan, blood test, you know. You have to roll out the neck problem. You have to roll out there's no tumor, cancer in your brain. You roll out all this thing, then you can't fit in any other disease. Then they will give you a name that is migraine. That's it. That's how you diagnose. It's not like cancer, tumor in brain. You just get a CT scan, that we see it, then we diagnose this is a tumor, a cancer in your brain. With migraine, you rule out everything. If you can't fit on any other disease, then they'll give you a diagnosis. This is migraine. It uses the history, it uses the conditions, the signs that you suffer from, you experience from, to diagnose migraine. Okay, this is how it might we diagnose the migraine. What is the strategy to treat spleen and stomach? Magical 8. We share this over time and time every day. Magical 8 is one of the strategies to treat spleen and stomach. Of course, if you know the 12 basic pattern of global balance and the strategy to treat spleen and stomach, any pattern that has including stomach and spleen meridian, and at least four of them. Each organs, at least 4 of the basic global balance that can treat stomach and spleen. Okay, like Tai Yin Yang Ming, and heart, spleen, Sao Yang, it can treat spleen. Tai Yin Yang Ming can treat spleen, heart, spleen, Sao Yang can treat spleen as well. And there's another one we call Tai Yin Tai Yang, can treat spleen as well. So there's three now, isn't it? So there's another one called Bao Jiao Pi Shen, or Bao Jiao Pi Shen. I'm sorry, I don't know how to say it. It's Bao Jiao Pi Shen. Well, you have to go and learn all those 12 basic global balance, so you know what is the strategy to choose to treat spleen or stomach, or spleen and stomach. Okay, there is no best strategy for one thing, because everyone is different. You have this spleen problem, but you have also other conditions. So when you're choosing the balance method, acupuncture global balance, you want to choose the main organs, then you want to go ahead and see what other organs suffer from it, make the decision of your diagnosis, like acupuncture 1, which 6 meridian and organ is. Then you make all the organs together, then in the end you treat. You go to acupuncture 2, and then you choose the balance pattern. Then step 3, you choose the point. Therefore, I'm treating more of chronic disease. So therefore, I treat a lot of patients with magical 12 and magical 8 or 8+1. Why is that? Because with chronic problem in your acupuncture 1, a lot of people suffer from just about all the organs out of balance. So there is 12 meridian. That's why it's so powerful. If you're just treating pain conditions, the acupain, you never understand why we use magical 12 a lot, because treating injuries with just pain and with treating chronic disease in a very different concept. Okay, but I want to tell you this: when you treat injury, because a lot of people have injury with pain, they actually have a lot of chronic problem. Then I know a lot of people who learn balance method acupuncture, they just focus on local balance and treating the pain, treating the symptom. That is far not enough to get people better, back to life. This is my opinion and my experience. If you're just treating patient with pain, injury, with just local balance, you may find that patient get better with just pain conditions, the injury. Then the others, they're not getting any better or difficult to improve. And another case is you can't get any results, or the results, the progress is so slow because you're not treating the organs. You're not balance, improve the organs function. So the injury, the pain, progress is slow. Okay, so I want to let you know that. Are the magical 12 better than the magical 12 root point? You get the wrong because Denise, you get the wrong idea. Magical 12 have a lot of magical 12 is talking about magical 12 meridian, which you treat all the meridian. Why you treat all the meridian is because acupuncture 1, you are diagnosing all the organs are sick, all the organs out of balance. Therefore, you choose magical 12. And magical 12 root point is one of the strategy under magical 12. So magical 12 meridian, when you come to magical 12 meridian, you decide to treat it is on acupuncture 2. Acupuncture 1 diagnose 12 meridian. Acupuncture 2, you choose a strategy of meridian balance is magical 12. Magical 12 is actually should say magical 12 meridian, right? Then acupuncture 3, you choose the point. And the point is what you just said about 12 root point. Magical 12 root points. Okay, then this is one of the strategy. You can choose other points for it. You can, according to the image, you choose magical 12 point, according to the image. Magical 12 point according to the organs, we treat root point. Magical 12 according to the imbalance. So if the young meridian is too strong, in meridian as all weak, we call running. So we reduce young meridian, or young meridian, you treat the sun point, or in meridian, you treat the mother point. So that is another magical 12 point strategies to choose the point. And if opposite is micro pose, which means the in is too strong, yang is weak, too weak. So now you reduce all the in organs or in meridian, which you treat all the in point of the sun. Then all the yang point of the sun, you choose the mother point. That's another 12 magical point strategy. So the strategy comes from where? It actually comes from the diagnose. Look at the diagnosis. Okay, if you diagnose in your patient condition right now, which one suitable for your patient? Okay, I always use magical 12 for migraine headache, and I do great results. Hi Carol, how are you? Happy that I'm not quite sure whether you're saying that you do get quite great result or you're not, because you put a question mark behind. You said I always use magical 12 for migraine headache and I do great results, but you're not putting comma, you're putting question mark. So I don't know whether you're asking or you're telling me that you're getting great result from magical 12 with migraine. Yes. Why migraine we use magical 12 is because we will talk about it in our treatment actually, but you're asking the question, I want to let you know this. If you're asking the question, I want to let you know. So magical 12, why using on migraine a lot? But I'm pretty sure every day if you do magical, thank you Mohan to give me a thumbs up. Thank you, and please tag your friend into here if they want to know about migraine, and if they want to understand about migraine. So share this video. So magical 12 used a lot in headache. migraine. Why is that? Because the headache is on the whole head, then it actually involved with a lot of a meridian. How many meridian go up to your head? All 6 young meridian, 3 young hand meridian, 3 young foot meridian, all up to here. So when you treat it, you need to use, if they're involved with all the meridian, then the best strategy is magical 12. It is. I use it a lot too. Have a patient, her migraine move. Veronica said, have a patient, her migraine moves from one side of the head to the other side of the head. Okay, yeah. Especially after eating chocolate. Yeah. Sweet things. Yeah. Chocolate. Yeah. Some are very sensitive to some type of food. You know, some with dairy. You know, and the chocolate, maybe caffeine, maybe not. And I want to tell you that caffeine can make you get headache or migraine. But at the same time, some patients experience caffeine actually help the migraine and headaches, you know. So it's totally 2 different things. I have patients have coffee and because of caffeine, and they get migraine, get headache. I have some other patients, when they know they come from headache and migraine, they take coffee because they reduce the headache. They help headache happen. They stop the migraine, you know. And I would say that I don't know the real reason, to be honest, but this is what the caffeine may cause migraine. Caffeine may stop migraine, you know. Yeah. A happy day says sorry. I mean, I do get good results. Okay, I've got you. Thank you for clarifying that. Yeah, because you put a question mark. I don't know. Oh, is a question or is it, you're telling me that you do get great result? Yeah, I'm happy for you that you do great result. Hi Nina, how are you? Well, more and more people come out. Please give me a thumbs up and say hello to me, and please share this video or tag your friend in. Tag your friend. Come to this live video. We're talking about because I'm answering all the questions that you have at the moment. Veronica said, but feel better after second treatment of migraine. That's good. Did magical 12 as soon as first 3 gene point. She said the pain is moving down the face. Great, because gene point is on for the head, right? So if you are acupuncturist, this is the whole head in here. If you do gene well point, it doesn't work well. It reduces. You can just do more point on over here, palm or back of the palm, and treat headache too. That's why hergu over here, or you treat the joint over here. Put some needle on the joint here. So 1, 2, 3, 4. Those 4 points are very good for migraine too. 1, 2, 3, 4. Okay. Where did I learn it? I learned it from the first book I discovered. This 4 point is from a book who's not a doctor, who's a reporter, and he was so sick and he learned acupuncture himself, but he couldn't do acupuncture. So what he did acupressure. He used matches to press the point. He used ear point to press, and he actually treat a lot of people. And those are the 4 point: 1, 2, 3, 4 for any headache and migraine. I'm going to show you again. 1, 2, 3, 4, right on the joint, right? Very good for migraine and headaches, right? But feel better after second treatment of magical 12. Great. Well, you one day give workshop on different magical 12 points. Thank you. Yes, Veronica, I will do that too, but it's not a time for me to do it. It's not a good time for me to. I'm too busy to other tasks. But yes, eventually I will do that too. Definitely, because in my workshop I actually teach the most that I use a magical 12, and I actually in Auckland, I didn't actually plan to teach everyone how to use the image, but people asked, so I actually show everyone how to do the image. The image is so simple and easy when you do come with Magical 12. And this is the original strategy from Dr. Tan's, Dr. Richard Tan, and it worked very well for the condition of pain, right? If the condition is very severe, and it worked very well. But I find it, this strategy, it worked very well for obvious conditions, but it doesn't really work well for, in my opinion and experience, it doesn't work well when there is no obvious symptoms, when there's no obvious conditions, you know. So, but the patient still have all organs imbalance. So first is how you actually go and diagnose is the most important. If you missing the part that this patient is the sick meridian, sick organ is not 12 or 6 sick of the meridian or organs, then you won't decide to use Magical 12. But I use Magical 12 a lot, not because of they have all the symptoms related to the meridian. I use organs diagnose. I use post-diagnose to tell all organs out of balance. So I choose Magical 12 strategy, Magical 12 meridian, but I choose the point differently. I choose the point target the organs. That's why I should use the root point. If you know this patient have a lot of symptoms, you want to treat the organs, and if you don't know how to choose the point, but you want to treat the organs, the best strategy for you is choose the root point. Not until you know the pose, you know which organs is too excessive, which organs too weak, and how do you balance one, reduce one, and tonify one. Not until you know this strategy, you can all go with root point, and you put experience with root point, and it works very well for you. You know, of course, it's not going to fix everyone, but in a lot of cases, just using root point, it will help a lot. I have problem treating hormonal migraine. Can you advise? Neither say that. Ask that. Okay. Yeah. There are few things. So hormonal migraine, it mostly happen in women, right? And it lead up to the period, and it happens with migraine. And unfortunately, patients get period every month, so they get migraine every month. So every month they have to what? They have to stop working and suffer from migraine. And therefore, I have patients stop the period, so stop migraine. What do? They take pill. They literally just get some. This is what the doctors suggest them. But I would say this is a bad solution. Why is that? Because it ruins your hormone too. By controlling your hormone and stop your period bleeding to get rid of migraine. This is not a natural way to do that, and I don't agree with that. You know, what I would agree with: get acupuncture, Chinese herbs, change your lifestyle to rebalance your hormone. Then you still get a period, but no migraine. Nida said, I had very good result with Magical 12 with a patient with Parkinson, no more tremor and no more pain. That's great. That's fantastic. Good to hear that. Nida, 12 magical point, 12 magical strategy. It can't treat hormonal migraine, but it is hard to treat. Why is that? Because you have to be very accurate, specific to which organ is weak, which organ is excessive. So you go and tonify one and reduce one, you know, especially for the twins organs like heart and small intestine, you know. So you need to be very specific to diagnose all this, and then you use 12 magical points for the hormonal issues. And other strategy is Dr. Tan's hormone balance, female hormone balance, plus probably OBGYN. You can Google it. OBGYN strategy points are all on website. You can go for it and find it yourself. There's a chart. I think Peter or Michael, someone who did the chart, and pretty useful. You know, you can just go. It's all free online, the information, and go forward and look at the chart. And I probably will post it out for you guys on the page, on my acupuncture page about this. Okay. Then the pain is described like a fishing hook. Okay, how do you treat pain along the right side of the nose, please? Now again, acupuncture 1, 2, 3. When you ask this question, you need to tell me where exactly the pain is. You say on the side of the nose. Then on the side of the nose, it could be what? Large intestine meridian. It could be, if it's more outward, it could be between the large intestine and small intestine, the two meridian on that, right? So what we're going to do is wait about the nose. So there's your eyes. This is in here. So halfway from here to here. Your eyes over here. This is your chin. So halfway from here to here. This is your nose. Okay, and then depending where the portion is, you get the portion in ratio, get it right. Use the image. Then choose either stomach meridian, spleen meridian, large intestine meridian, lung meridian, liver meridian, and kidney meridian, pericardium meridian, and what else? That's it. Yeah, all those meridian I just named out, they all together can treat large intestine meridian and stomach meridian. Okay, that's it for today. We're supposed to talk about just what is migraine, but I'm happy for you to ask me all those questions, so I have more chance to explain and to let you to give you more information and to give you some advice and to share my knowledge in here. Now we talk about some treatment, right, today. But that's not my purpose to talk about treatment today, but I'm grateful that you asked your question. Okay. Tomorrow, we're going to talk about what are the symptoms of migraine. So we named some symptoms today, but tomorrow we're going to talk about the deeper about the symptoms. Then the following day, we're going to talk about what causes migraine. Okay, we know it's unknown, but there is something that can trigger migraine. We need to talk about all the trigger. Okay, what is in your life, the things that you do that they can trigger the migraine, right? And the real reason we don't know, but it's okay. Because those trigger, we can manage it. So if you manage all this trigger, then you can avoid migraine, right? Stay awesome, and I love you all, and I'll see you tomorrow. Thank you very much. Bye-bye. And remember that we have on the 30th of May, so in 2 days time, we'll have a workshop talking about a webinar talking about how to treat IBS. So if you want to join in, please go to my acupuncture page. The link is in there. I put it in the event, so click it in and register yourself. Okay. If you can't watch it on live, join on live. Doesn't matter, because I'll record it and put it online. But still, key in, register, so we will send the email to you. Okay, so when this recording is done, right? Stay awesome, and I love you all. Yeah, it is free. It is free. You know, go to my the other page, which is Szenan-Balance method, spirit acupuncture, G acupuncture. Thank you, Nila. Bye bye.